Aiming to better understand mental and physical health of Black Americans amid the pandemic and social unrest. That is the goal of Project Trinity here in Oklahoma. Joining me now is Dr. Adam Alexander. He is the lead researcher on this project. Dr. Alexander, good morning to you, sir.
Good morning to you as well.
So before we dive into the specifics here, tell me more about how Project Trinity came together.
Oh, of course. It was the summer of 2020, and I was under stay-at-home orders. So I was at my apartment, and there were protests that were right outside. And I heard, "No justice, no peace." And at that moment in time, I thought about how I could contribute to this movement. And that's when I started writing this grant proposal to investigate the impact of the coronavirus pandemic and social unrest on the health of African Americans, because I really resonated with that movement during that time.
Yeah, and as you mentioned, 2020, quite the year for Black Americans here. So many things happen. And let's start here with the pandemic. We know the virus disproportionately impacts the Black community, but its potential impacts here go beyond the actual virus, correct?
Yes, yes. The economic impact of the coronavirus pandemic is something that shouldn't be understated. African Americans are right now disproportionately suffering from the economic fallout of the coronavirus pandemic. I think unemployment among African Americans is that double that of whites. Many African American families are having trouble paying their bills and having to dip into their savings and retirement accounts to cover some of the expenses at the end of the month.
And another issue here, another kind of example of how the virus has impacted the Black community is the lack of trust that people have for the vaccine, especially in the Black community, correct?
Oh, that is absolutely correct. The mistrust with medical institutions is one of the reasons why we see low vaccination rates among African Americans. But I think the community, people in the community are picking up the slack in that regard, because there's many churches, community organizations who are holding vaccination shots at their organizations. And I think that receives a better response with the community than relative to going to a medical institution to receive the shot.
And as you mentioned, it wasn't just the pandemic here, racial justice, everything that happened last summer. I know just personally, me coming home from a long day of covering some of the stuff that was happening, I sat in my car in my parking lot and I just started to cry. The tears just started to flow. And I can't even imagine how it impacted other people around the country. How can seeing those images that we saw all summer impact the well-being of Black people?
Well, mental health is the primary concern here. Even when you view these videos on social media or through the news, this has a very detrimental impact on mental health, particularly depression and anxiety. And you can compound this fact with the age we live in, where social media allows these videos to just proliferate through many different areas. And so you're constantly bombarded with these graphic images of African Americans being injured, or in some cases killed by law enforcement officers. Not only are you dealing with just severe mental health issues, but you're also going to be looking at widespread distrust of more institutions. And I'm particularly pointing the finger here at law enforcement institutions.
And I can't even imagine the impact this had on children and the conversations that parents were having with their kids upon watching the stuff that was going on.
Mm-hmm. Oh, most definitely. After seeing these images and videos, I'm sure many African American families had to sit down with their children to tell them, how do you interact with the police officers when you're actually pulled over or stopped with an officer? Because you don't know where these altercations might lead. In most cases, we wish they have a peaceful outcome, but it seems in these rare instances, these encounters erupt into very violent situations.
So ultimately, everything you learn here in terms of studying the pandemic, studying racial justice, how will you help apply this to help the Black community and impact the Black community?
That's a very good question. So I'm collecting this data in Oklahoma. And the first thing I want to do is to bring this data to the communities that have supported this project. I would like to have their voices heard. And to do that, I would like to invite law enforcement officers and community leaders to sit down and engage based off the data I'm presenting with them. I would love to be able to show them, this is what happens when we have a violent encounter with a police officer, and that results in the loss of an African American life. This is how much your trust is impacted here. And here's what we can do to repair that. And that's what I want to do. I really want to move the conversation forward into having really actionable policies we can implement that will help restore some of the mistrust between our institutions and the communities in which we try to serve every day.
I did see someone here, a few people that were critical of the study. They said the pandemic and the racial justice protests impacted everyone, not just black people. Why are we just focusing on them? What would your response be to that person?
That's an excellent question and a very valid point. And I'll tackle the social justice issue first. When in the heat of the protest during the summer of 2020, that started because an officer had the knee on the neck of an African American man. And this is a conversation that's had between African American families and their children. While people who are of other ethnicities and races may feel empathy and sympathy for our cause, this is a challenge that all African Americans are going to have to face going forward in our country in 2020 and 2021. And speaking about the pandemic, you can't really argue the facts here that the pandemic has disproportionately affected African Americans relative to whites. And we know that when we have these type of events, these events often create new health disparities and exacerbate existing ones. And so if we want to solve this problem, we have to actually go to where the problem is at. And that's where my study is seeking to do, investigating the problem where it's at and looking at the consequences going forward in order to mitigate it in the future.
All right, Dr. Alexander, just a few seconds left here. Where can people go if they want more information or if they want to volunteer for the study?
Of course, please email us at the Trinity Project at oushsc.edu. You can also email me at adamalexander@ouhsc.edu. And the study will be launching on February 22nd, so please look out for it.
All right, Dr. Adam Alexander, the lead researcher on Project Trinity. We appreciate your time this morning, and feel free to come back. We want to know the results of the study and what you find out. So as soon as you learn that, please come back on our show. We'd love to have you.
It was a pleasure being here.
All right. John